Everybody, I hope everyone's excited to talk about our topic today. I'm super excited to talk about our topic today. So for those of you who don't know me, I'm Debra Muth. I own Serenity Healthcare Center, which is a functional medicine clinic in Waukesha. And my specialty has been women's health for about 20 years. I do a few other things, but women's health is still my love. And so tonight I want to talk about hormones and sexual dysfunction. I've been doing this a long time, and I can tell you pretty much 95% or more of the patients that I see that are women over the age of 35 or 40 all have the same problem, and they have no sex drive. It is a common thing. We are not alone in this. The unfortunate part is until recently, there really wasn't anything available to help women. We have some herbs that work for some people. Hormones definitely work for some people, but we really didn't have anything else. So it's great that we have Viagra for men, but my question always is, well, who are they having sex with? Because their wives don't want to have sex anymore, right? They're like, go away. So it becomes a problem when we have something for one sex and we don't have something for the other sex. And I'm really excited because we do have something now, and it should be commercially available in the next 6 months, although they said that in July, and it's still not commercially available. So we can get it compounded, and so we'll talk about that, and we'll talk about some other options, and we're also going to talk about why this happens to us, okay? All right, so, okay, what's going on? There we go. So our goals for tonight are to look at sexual health, look at why it happens, what happens to our hormones, what happens to neurotransmitters, what happens to different things in our brain and how it connects with our brain and why we feel that way, and then look at some new exciting options for treatment. What did I just do? Hey, Dan. Oh, there we go. Hang on. I don't know what I did here. Okay, what's going on? Oops. There we go. There we go. Perfect. Okay, so I told you what I see in my practice with women. This is some statistical data. So research shows about 43% of women and 31% of men of all ages report some form of sexual dysfunction. It is an unfortunate thing that we are seeing erectile dysfunction happen in 20 and 30-year-old men these days. That never happened before. We saw that happen in 50-year-old men 15 years ago. Now we see it in 40-year-old men, 30-year-old men, and even some 20-year-old men are starting to have some erectile dysfunction issues. Some of that is correlated to hormone loss. We're seeing more 20-year-olds without a lot of testosterone. We can thank our food source for that because we put a lot of estrogen-based products in our food source, which is contaminating some of our men and is causing some testosterone deficiency as a result. Okay. Our Merck manual reports roughly, as of 2018 data, 50% of all men between ages 40 and 70 will have some degree of erectile dysfunction. That's a huge number. Viagra does help, but it doesn't completely help. And for some men, it's not an option at all because it helps to increase blood flow and circulation. But for some men, it's not a blood flow issue. For some men, it's a central nervous system issue. For women, it is never really a blood flow issue. It's always a central nervous system issue, and it's a hormonal issue. So if we have something that stimulates the brain all the way down to the spinal cord and into the pelvis, we can fix a lot of these issues. For women, unfortunately, our sexual dysfunction starts in our brain. If we don't have a thought here, we are not interested here. I mean, let's be real. How many times can your husband say something to you and you look at him and you're like, you are such a dumbass? And a half an hour later, he's like, honey, come on, let's go to bed. And you're like, get away from me. You just made me irritated by you an hour ago. And they don't have a clue. For them, it doesn't matter. They can turn sex on and off like that. For us, it's very different. We have to be all engaged up here before we want to do anything else. Not always like that when we're 20, but definitely like that the older that we get. Okay, so we have to fix that part of things that are going on in our brain if we want to have that intimacy. When for them, the only thing they have to fix is physically what's going on around here. That's all they have to do. It's very easy for them. Okay. All right, so here are some more statistics, more studies. As of 2012, this study showed that menopausal women have an increased risk of sexual dysfunction. Desire, 57, 38% were normal, 62% had a dysfunction. Our arousal, so our ability to become stimulated, 70% of women have a dysfunction in stimulation. Lubrication, the older we get, the worse this gets. 70% of women have a problem with lubrication. If we have dryness and we have pain with intercourse, we're not going to be so interested in doing that too often. The first time that you're uncomfortable for 3 days after sex, you're going to be like, yeah, no, not interested, thank you, go away. It has to be something that's sensual. It has to feel good, or why would we do it, you know? So if lubrication is an issue, that's a problem. Orgasmic dysfunction, 49% of people. How many people remember Golden Girls? Do you guys remember the episode when, oh, what is her name? The one that was from Minnesota. When I remember the episode clearly, and I can't remember what her name was on the show. But anyway, they were talking about their first time with sex. And of course, Blanche always had millions of orgasms and millions of guys. And she said, you know what? I was married 5 years before I realized what it was that made your eyes roll in the back of your head and why you liked sex. This is our orgasmic thing. Not every woman has an orgasm every time they have sex. Some women have never had an orgasm with sex. They have no clue what that feels like, to be totally out of your body and like, oh my God, this is what this is supposed to be like. Many of us never experience that. And some people it's a primary issue, and some people it happens after surgery or after a baby or as their hormones fall. Some women can only have a clitoral orgasm. They can't have a vaginal orgasm, or they can't have an orgasm when somebody stimulates their G-spot. So these are all areas that we have that ability to do that, but not every woman has that. And most men might not even know that those areas exist. Most women might not know those areas exist, and that we have to tune into some of that, and we have to work with some of that to really get our bodies to do what we want them to do and have that stimulation. Satisfaction, only 44% women will say they're satisfied sexually. Isn't that sad? It's a sad number. Pain, 52% of the women have pain with intercourse. But yet we still do it because it's our womanly duty to do that if we're married. But it's not comfortable, and if it's not comfortable, we're not going to care about it. We're going to be like, okay, I'll do this, but get it over with as quickly as you can because I can't deal with this. And that's not a great place either. We should be able to make intercourse more comfortable for women. Sometimes there's a reason. You know, if women have endometriosis and there's a lot of adhesions in the pelvis, and that pelvis doesn't move during intercourse, there's going to be a lot of pain. And we can't really fix that unless somebody goes in and surgically removes those adhesions. But if we're having a lot of pain because we have vaginal dryness and our hormones have gone away and the change in the pH of the vagina has changed, that we can fix, that we can make better, okay?
What's interesting is
Yeah.
how often the normal and the dysfunction, how similar they are. You know, from everything from orgasm down, they're not that far apart in terms of percentage.
No.
But, so when you're young, you get arousal and lubrication.
Very easily.
But everything else,
Yes.
and then desire.
Yes. When we're young, that hot 20-year-old that walks by with the six-pack abs, your eyes are going like this. When we're 40 and they walk by, you're like, oh yeah, okay, whatever. I didn't even recognize them.
To reproduce when you're young.
Exactly. That is true. That is true. Okay, so during postmenopause, so once you've never had a period again, you've missed a year, you're not having any more periods, we consider you postmenopausal. There are changes that happen to the vaginal tissue. It becomes thinner, it becomes drier, and without estrogen, the pH changes in the vaginal tissue and the vagina actually starts to shrink. It goes back to its pre-puberty state, so it shrinks this way and this way. So everything becomes more narrow, becomes more tight, and more uncomfortable. The old saying, if we don't use it, we lose it, is very true in this fashion. So the longer we go without intercourse, the more uncomfortable it becomes to have intercourse again. And if you go a long enough period of time, it'll feel like the first time you had sex all over again, which is going to be very uncomfortable for most women at this age because that tissue no longer has estrogen, no longer has lubrication, and it becomes very easily torn. And so women can get vaginal tears with intercourse and get some bleeding. And then it's like, okay, I'm not interested in this anymore. So all of those things affect our desire part of things, okay? I have a little picture here. This is what estrogen looks like on the vagina. So this is vaginal tissue with estrogen. This is vaginal tissue without estrogen. Very flat, there's nothing there. It's not good, okay? This is why when we're postmenopausal and you go to have a pap smear and they try to put the speculum in and you're like, stop. This is what happens with that tissue. And the same thing happens when we try to have intercourse too, okay? So what kind of treatment options do we have? Well, first, we always want to look at our relationship. We need a healthy relationship. As women, we need a connection. We need a healthy relationship. We need to like our partner. We need to have something that we feel like, okay, yeah, I want to be intimate with you. I want to be vulnerable with you, okay? For a lot of us, as our relationships age and we're together longer, we stop doing fun things together. We stop having date night. We stop caring about getting dressed up for our husbands, and our husbands stop caring about doing that for us too. And so that affects our relationship. We have to want to be close and have those conversations and be able to feel like we felt when we were a young couple, you know, where you could connect and you could talk and you could have time together. When you're young, you usually don't care. Like the kids are running around, okay, fine, let's go have a quickie and I'm done, out of here, get going. You gotta go take the kids here, you gotta go take the kids there. When the kids are gone, you want that relationship, you want that connection back again. So sometimes we have to work at that a little bit, okay? We have to identify things that turn us off. It's, I think, difficult for women to say, I like this during sex, I don't like that during sex. We have to be able to say, this is what I like and this is what I don't like. And when you do this, I get turned off. Now we have to be careful how we say that because men can be very sensitive. We don't want to hurt their feelings and we don't want to make them feel bad. And how many of you have had your husband say, I don't think you like me anymore. That's why you don't want to have sex with me. I hear it a lot. All my patients tell me the same thing. They think that I'm not interested in them. I'm not attracted to them anymore. It really doesn't have anything to do with that for most of us. You know, it's not like that. It has something to do with all of the other things. It's not that you don't love them. It's not that you're not attracted. But we have to get back to what is it that I want? What is it that I need? What is it that turns me on? And it's okay to be kind of selfish about that and say, this is what my needs are. Because trust me, they're going to make sure their needs get met. One way or another, they're getting off. It's going to happen, but that doesn't necessarily mean that you're getting off because they're getting off. They can have an orgasm without much work. It's much harder for us, and it's much harder for us the older we get to have an orgasm. It takes a lot more work and a lot more effort for us to have an orgasm the older we get without hormones. For men, it can take longer time getting started, but they usually still can end just as easily as they did before, okay? So it takes a little more work on both of our parts. Okay. Certain medications can cause a decreased sex drive and cause erectile dysfunction. Blood pressure medicines are very common for this. They create issues with blood flow, and there can be a lot of erectile issues for men, but it can also affect women. It can affect their desire, and it also affects the blood flow to the vaginal tissue for them. So things can tend to feel a little bit different. For some people with blood pressure, we have to be cautious too, because if their blood pressure tends to drop a lot, they're going to feel really lightheaded and dizzy when things like that happen, because a lot of that blood flow during sex is going to the pelvis. It's going away from the heart and the head, and so they can get really lightheaded and dizzy and woozy, and that might make them feel not very good during intercourse.
And could that cause a heart attack?
It would have to drop pretty low for that to happen.
So you think it's not
I don't think it's likely.
Even if they're feeling woozy, it's
Yeah.
not a, oh boy, we better stop.
No, it's more of put your feet up and get some blood back up to your head for a little bit.
Okay.
Okay, some people will say sex therapy, sex counseling. I think that's an okay thing to do, especially if there's relationship issues or if there's been sexual abuse or sexual trauma. I think we have to have those conversations. We have to be able to say what's comfortable for us, and sometimes we need a third-party person that helps protect us and helps stand up for us to say things comfortably and teach us how to speak to each other about some of those things and how to be open. So sex therapy, sex counseling can be really helpful. Bupropion, which is Wellbutrin, is not FDA approved for sexual dysfunction, but we have used it for many years for sexual dysfunction because of how it affects our neurotransmitters. So things like serotonin, dopamine, norepinephrine, epinephrine, it can affect those things, and that can help us with desire. Okay, yoga is another thing. We don't think about yoga so much, but yoga can be very helpful because it helps us really strengthen our core. And for women who have bladder issues or prolapse or incontinence issues, that can be very uncomfortable during intercourse. If you're afraid that you're going to pee on yourself during sex, you're not going to want to have sex very much. Or if you have what's called a rectocele, where you have a lot of rectal pressure during intercourse, you can have a pouching of the rectum, and that causes a lot of pain and fullness, and it'll almost make you feel like you're going to have a bowel movement during intercourse. That doesn't make you want to have sex very much unless you can be in a position where you can control that pressure. So yoga allows us to do that by strengthening that core. There's something called PiYo, which is a Pilates yoga mix that I found to be very helpful with core strengthening and pelvic strengthening. Helps you do those Kegel exercises and re-strengthen that whole vaginal area for you. Okay. Okay, so herbs that we can use are maca. Maca is one. It's a very nice herb. It's been around for centuries. You want to use roughly 600 to 800 milligrams for sexual dysfunction with maca. It's also very good for your adrenal glands, so it helps support the adrenal glands, feed them a little bit. So for those of us who burn the candle at both ends and are kind of burnt out in certain areas, this is a really nice adrenal tonic, but it does help to stimulate sexual desire, helps you reach orgasm a little bit better as well. Red clover is something that we use a lot in postmenopausal women if they don't want to use hormones. It's a nice adaptogenic herb. It does help increase libido, also helps increase mood and sleep. You can use roughly 3 milligrams, but it's going to take a while. It usually takes a good 90 days for it to kick in to really start to notice a difference with it as far as the hormones and the libido goes. Okay. Korean ginseng works really nice. Ginseng is also another adrenal tonic. It is very stimulating, so you don't want to take ginseng at night. You want to make sure you take that in the morning time. In order to get sexual desire, you need a lot of ginseng, about 3,000 milligrams a day to help with libido. You do want to be careful with ginseng because it can cause some blood thinning, especially at higher dosages. So if you're on something that thins the blood, like aspirin, or you're on a medication that thins the blood, you don't necessarily want to use ginseng with that because it can really thin the blood too much. That's spelled wrong, sorry. This is Tribulus, T-R-I-B, and it's only one L. Tribulus is a androgenic herb, so that means it helps create our male hormones like DHEA and testosterone. So men and women can use that. And actually men and women can use any of these except red clover. That would just be a female herb. But Tribulus is really good because it helps to increase testosterone levels for us. That's how it increases our libido. It can also help increase our vaginal secretions so we have less vaginal dryness. I have used it in men, young men who couldn't use testosterone to raise their testosterone levels, and it works very well. In women, it does raise their testosterone, but not nearly as much as it does men. So it will spike up a little bit, but not huge numbers, okay? Okay, Mucaniparinus is a herb that we use that increases dopamine. Dopamine is a neurotransmitter that we really need to be present for sexual desire and mood. So it really helps our brain turn on. Without enough dopamine, we're going to have a very difficult time wanting to be sexual, okay? It also reduces prolactin levels for us. So for some women, when they have hormonal issues, their prolactin goes high and then their other hormones go down. This helps to balance that out a little bit. It'll also increase testosterone, also helps to create something called growth hormone. So when we're 20, we have a lot of growth hormone present in our body. That's why we can do so much and not get injured. But as we get older, our growth hormone levels go down, and without growth hormone, our skin gets thinner, our muscles don't repair as well as they used to. We have more insulin issues without growth hormone, and sexually, we don't have as as much desire without growth hormone. So you'll see in a lot of the anti-aging communities, people will use a lot of growth hormone. Sylvester Stallone is a good example of that. He's 70 plus years old and uses a lot of growth hormone, and he does not look like he's 70. Arnold Schwarzenegger is another one that uses a lot of growth hormone for repair and keeping them younger again. Colostrum is actually something that's very rich in essential vitamins and minerals. It helps stimulate the immune system, but it can also stimulate sex drive. With colostrum, it wouldn't be my first choice for sex drive stimulating, but for somebody who isn't absorbing nutrients very well, this would be a great way to start, especially if they're sensitive to things, because it's healing the gut, allowing you to absorb your nutrients and your minerals so that your body can have everything it needs so your whole nutritious system can function properly again. Orchex is actually bull testicles. Rocky Mountain oysters, has anybody heard that? It's the same thing, except it's ground up and freeze-dried in a tablet, okay? Most of the time, this is not something that we give to women. It's something we primarily give to men. On occasion, we might give it to women if we need to really increase their testosterone. If their testosterone was just flatlined, this would be something we could use in a temporary thing to bring it up and then transition them over to something else. But men can actually use this very nicely. Because it allows for all the sex hormone precursors to be developed out of it. So it's a glandular, much like thyroid glandular is, so it feeds everything that it needs. They do make a product for women called Ovax, which does the same thing for our ovaries. So for women who can't use estrogen and progesterone, it's a great product for us to use to try to get the ovaries to make more hormones. At some point, they're not going to make anything, but if you had a glandular there, it could help produce some hormones on a small level for you. Okay. Vaginal dryness. So if we're just in the beginning stages of vaginal dryness, vaginal estriol works beautifully, okay? Estriol is your most common estrogen that's found in the vaginal tissues. Your body actually makes 3 forms of estrogen. It makes estrone, which is your bad estrogen. You do not want a lot of that present, but unfortunately we make the most of that after menopause. Estradiol is your primary estrogen. That's what controls our hot flashes, our night sweats, our periods, helps us ovulate, produces eggs for ovulation. And then estriol is your weakest estrogen. It's not so great at managing any symptoms, but it's the most primary estrogen that we find in the vaginal tissue. So when we replace estrogen in the vagina, it's usually estriol. It has to be compounded. The only thing that's commercially available for vaginal dryness is estradiol. It is still considered a natural estrogen, but it's your strongest estrogen, and it's not the type that's primarily in the vagina. It works very well, but we tend to like to give things that are where they're supposed to be. So we can give vaginal estrogen, and typically you would use that every day for a week, and then after that you would just use that 1 to 2 times a week as you need to. Some women need to use it a little more frequently, like 3 times a week, and that's fine to do that. If there's an orgasmic problem, we will mix estriol with testosterone or with DHEA, and that helps to increase stimulation to the pelvic region so that orgasm is easier to reach than with that testosterone. If there's a pelvic floor issue where there's more incontinence, adding testosterone is really great to help beef up that tissue and give you more muscle strength so you can hold your urine a lot better. So oftentimes we will mix the two together if people are having those kinds of issues as well. Yeah?
You said that normally that estradiol, is that right? Or
estradiol.
Estradiol, okay, is what's in the vaginal creams, but
commercially available creams.
Okay,
Yep.
Okay, but what about compounded? Is that the
compounded? We can make it whatever we want. So we could have them compound estradiol, but we don't. We usually have them compound estriol.
Okay.
Because that's your weakest estrogen, but it's the most prevalent form that's in the vaginal tissue.
Okay, so if we're getting it here, it's the best kind.
Yes. If you're getting it from Dan and it's vaginal, it's most likely estriol.
All right, because he wouldn't do anything else unless he was.
Well, he would do whatever the doctor would tell them to do. So if you have a doctor that knows what they're doing, it should be estriol.
Okay.
Okay. Vaginal moisturizers, those work really great as well. So lubricants work good. There are a ton of lubricants on the market, okay? Everyone, I'm sure, has seen the KY commercial, his and hers. They have those. There's a really awesome place if you ever want to take a field trip one afternoon. In Madison, there's a place called A Woman's Touch. It's a upscale female sex toy shop, okay? It's ran by 2 female social workers, and they primarily created it for women with sexual dysfunction that wanted a discreet place to go that could get information discreetly and privately, and you can consult with them, and they do sex therapy and counseling and things like that. But it's a really great place to explore different things. But they have a ton of really great lubricants, and you can actually go on their website too. They have a website.
What is it called?
It's called A Woman's Touch,
Okay.
and it's in Madison. They make a product called Silk, which is really nice. And they make, the other one that I really like is called Uber Lube, U-B-E-R, like Uber the car, lube. That one I really like. The downside to it is it does have a little bit of a chemical base to it, so if you're sensitive to chemicals, that would not be a good one. But the reason I like it is because it has no taste, it has no odor, it has a great longevity to it. It's very slippery, it's very silky. It lasts a long time, and it doesn't get thick and tacky. With some of the lubricants, after a few minutes of using them, they start to get very sticky and very tacky, and by the time you're ready for intercourse, you don't have anything there that's moisturizing enough, and then you reapply, and then it's just sticky again. So Uber Lube is very different. It's a silicone base, and so it stays around for a very long time. And some women can actually just use this as a lubricant during the day if they're uncomfortable, because you can just take a little bit of it and wipe it on the outside of the vagina, and it lasts for hours without dripping out of you or rubbing onto your clothes and things like that. So it's very nice. It adheres to the skin very nicely. So that is another good lubricant. They also make some estrogen forms commercially in rings and tablets, like they make an estradiol ring that you can insert in the vagina, but usually you need to leave that in for 7 days at a time. It tends to fall out a lot with bowel movements and activity and things like that. So most women, they'll try it, but it's not usually something they're going to stick with for a long period of time. Your creams or your tablets, or I call it a pellet, Dan and them call it a tablet. It's like this little waxy bullet. It looks like a Tic Tac. It's very small. That's probably my favorite application of estriol because it's not messy and it melts very quickly. And you don't get up in the middle of the night and have it running out of you like a cream does. So that's my favorite application for estrogen. But
so the Silk lubricant, that's
Yeah.
better, that's less chemically?
no, it's a silicone base.
Okay.
Now you can also use common things that you have around the household. Almond oil, coconut oil, olive oil. Those things all make really nice lubricants as well. And they're not going to increase your risk for yeast infections or anything like that. So you can use common household oils like that as well. It's not going to hurt anything.
And what about KY jelly? That's safe, isn't it?
It's safe.
Okay.
Yeah, KY is fine. So we also can do systemic hormones like systemic estrogen and progesterone. Those things work very well for us. When we don't have our hormones balanced once we're postmenopausal, we're going to have more problems with sexual dysfunction, okay? Desire, mood, everything just kind of goes down if we don't balance the hormones properly. So we always want to start there if that's a problem, but then we also want to look at neurotransmitters and go back and look at that dopamine and see if there's issues with dopamine as well if the hormones don't fix our problems, okay? Okay, arousal. Well, I should say this too. Let's go back here. No, I'll talk about it here. Okay, arousal difficulties. So a lot of women after menopause will say, I really just don't feel much below the waist. It's no different than you holding my hand. I don't feel anything. The nerve endings change and things become very different, and the sensitivity to the vaginal tissue changes as well. So sometimes we have to incorporate various things to help us get more stimulation. Vibrators work really well. If there's a narrowing of the vagina, sometimes we have to use something called a dilator, and I have a picture of what that looks like in a couple of slides down. And I'll talk a little bit more about that at that point too. They do make vibrators that stimulate the clitoris. They make vibrators that specifically get to the G spot. So if our partners are having a hard time figuring out where that G spot is, They have assistants to help them figure that out and reach that. And I would encourage women to not be embarrassed or worried about using vibrators. They are fine, they're good for us, it's not a problem. You want to get a good quality one. A good quality one is usually a silicone base, and you typically wash them with just warm water. Some of them you use soap and water, but most of the time it's just warm water that you use to wash them with. We have on occasion given women Viagra for orgasmic dysfunction, especially women who are on antidepressants. When you're on antidepressants, it changes the way the neurotransmitters are set in the brain, and sometimes adding Viagra to that mixture can make a big difference with desire and arousal and stimulation. So Women's International Pharmacy out of Madison actually did a study, gosh, I think this has been 15 to 17 years ago. It's been a long time ago that they did this study. They studied it in about 100 women that were on antidepressants, and they gave them sildenafil, which is the active ingredient in Viagra. And it significantly made a difference in women on antidepressants. Didn't make such a big difference in women that were not on antidepressants, but the women who were on that, they did very well with Viagra for reaching orgasm. So that is an option for us as well. And then PT141 is a peptide, and I will talk about that a little bit later, but this is our new exciting thing, is PT141. Okay, so PT141 is a peptide. Peptides are made from amino acids, okay? So typically we should absorb amino acids from our protein sources, but what they've identified is because many of us don't have that ability to convert amino acids from proteins, they've been able to identify different amino acids or different peptides from a chemical chain, and they've been able to identify certain activities for them. So there's about 3,000 different peptides that have been studied now, and many of them are available from a compounding pharmacy, but not yet from a drug company. There's a couple that are available from drug companies, but not all of them yet. So PT141 was an accidental find. They were using it with a peptide called melatonin-2, which helps create something called alpha MSH, which helps to give us a lot of energy. It's something that we look at in people who've been exposed to toxic mold. Typically their alpha MSH will go down. And so what they were studying with this melatonin was that it would make the alpha MSH go up. And for a while, alpha MSH was actually available commercially in this country, and then the FDA took it off the market. It is still available in Europe, but not here. So melatonin was a peptide that they found they could increase alpha MSH. It makes you tan, so it's a natural tanning peptide. But what they accidentally found during the clinical trial was all these people started reporting sexual arousement, male and female. And so they started going, wait a minute, what's going on with this? And so they started to do other studies on just PT141, which is a peptide they could extract from the melatonin peptide, and it would not give you this tanning problem. Because when you use melatonin, if your skin gets dark from it, it's permanently dark. It does not reverse. So they were able to pull out PT141 and find that if they gave it to both men and women, they could get sexual arousal out of them. Well, it got even better. So it not only increased arousal, it increased sexual stimulation. So it makes everything intensify in the pelvic region. And it helped with men with erectile dysfunction. It helped with females with sexual dysfunction. It helped with lubrication, and it helps very quickly. So when you use PT141, unlike Viagra that increases the blood flow, this plays a role on the central nervous system starting at the head and running all the way down the spine and into the pelvic region. So it's different. So people who have cardiac issues or blood pressure issues that maybe can't use Viagra because of that increased blood flow have no contraindication in using PT141. So that's a nice thing. It also helps stimulate dopamine, and very quickly and rapidly. Dopamine, we know when it's low, it will create sexual dysfunction in both men and women, okay? We were told in July that PT141 was going to come to market in a pill for women within 6 months. It's still not here. So here's a nice stock tip for you guys if you're stock people. Go look at a company called Palatine. They are the ones that are manufacturing this as a drug. They have a contract with another company to market it, and hopefully it'll be coming soon. But right now it's available as a peptide that is only injectable. So it's a sub-Q injection. It is not something you do all the time. You can inject this up to 3 times a week. It works within 30 minutes to about 2 hours before it kicks in. It can last up to 72 hours, which is very nice. So if you miss your window and you're like, oh, shoot, I took this and now all of a sudden the kids surprised us and they're here for the next 4 hours, you don't have to worry. You're not going to run out of your time. Your window is still going to be there. But I will tell you, your brain is going to just think about sex once this kicks in. Yeah, it's pretty intense. Men can end up with spontaneous erections that can happen for over 24 hours.
So they have an erection for over 24 hours?
Not continuously. Okay. They should not have an erection for more than 4 hours. That would be a problem. But it could be spontaneous, come and go, come and go, come and go. It also makes it much more difficult for them to reach orgasm. So they are not going to go off like this. It's going to take a little bit of work on our part, which is kind of what we want, right?
Yeah, but it's not a good thing though, because if you're sensitive and you just want it to,
it's a good thing if the two of you are using it together. Right. Not so good if your husband or partner is using it and you're not, because you're going to be like, yeah, go away. Okay, I'm done. Yeah, it's definitely something that if they're going to use it, you want to use it as well. It also makes you start to think about how it was when we were younger. Like all of a sudden, you want to get dressed up again. You want to, look nice. You want to go for dinner. It's kind of like this, let's go, let's be intimate, let's have this date, and it makes you start to feel sexy again. Because let's face it, when you've got kids running around and all this happening and the groceries need to be put away and this needs to be done, you're not necessarily thinking sexy, I'm thinking, I just want to put my pajamas on,
Does it give you energy as
It does.
Well?
It does give you energy.
Okay.
It does give you energy. It forces us as women to have our brain go along with our physical being. I'll put this back up here so you guys can see this. So it's a very small needle that we use. It's an insulin needle, so it's very small. It's a sub-Q injection. It's not painful at all. There are 2 side effects that you typically see with PT-141. I should say 3. Some people can get a headache from it, not a migraine, but they can get a little bit of a headache. Some people, if you're sensitive to medications, you can get this kind of warm flushing response to it. It usually lasts about 15 or 20 minutes. You just feel really warm and hot. And some people, if they dose too much of it, they can get a little nauseated. That too doesn't last very long. It lasts about 30 minutes and then it goes away. There are things that we can do if people get really sensitive to this. You can preload with a little ibuprofen or something like that if you get a headache. If the nausea is really bad, we can give you a little anti-nausea medication to relieve that if you want to. The flushing's not horrible. It's just kind of this whoosh feeling and then it goes away after a little bit. Okay.
Why did you say they took it off there was a product that they took off the market here, but it's still available in Europe? Why?
That's the alpha MSH. The FDA took that off the market, not because there was anything wrong with the alpha MSH product. It was one of the drugs that was on the list for the FDA to take off. They have a whole list of hosts of things, and it was taken off the market a very long time ago, like over 10 years ago.
But why? Somebody didn't pay somebody off, or? I mean, if there was
That's a great question. There is no scientific reason or any bad thing that happened with alpha MSH to take it off the market, but the FDA has a list of drugs that they no longer want on the market, and that was one of them.
Okay. All right.
Yeah.
So now is this PT-141 available in injection form now?
It is. It is available now. The only compounding pharmacy that makes PT-141 is a pharmacy out of Kentucky called Tailor Made. I will tell you, I am the guinea pig for everything that I recommend to people. So I tried this, and I tried this with my husband, and I have to say, it is amazing. So I am just like everybody else when it comes to sex. I'm like, yeah, okay, I could take it or leave it, no big deal. We've been married 29 years. It's like, you know, we can probably tell each other in our sleep exactly what we're going to do. After a while, it's kind of like, okay, there's no big surprise coming. So, all right. And so we both tried this, and it was amazing. I was shocked because there has been nothing on the market that I have seen in 20 years that does what this stuff does. My husband has bilateral sciatica. He has had it for 10 years. He's been a failed back surgery person. He first took this, and I was shocked. It made his sciatica go away for 4 days. And that I think he was just as excited about as what it did for everything else. But he was like, I don't have sciatica, and it's been 4 days. And I'm like, dang, that's really good. And the reason it did that was because it works on the nervous system all the way down the spine. So he had some relief from that. But aside from that, the erections are much more intense. They're stronger. They last longer. Orgasm for men and women is much more intense. Clitoral stimulation is through the roof. I mean, you don't even, you could look at it and you're already stimulated. You're like, oh my God.
Do you need a prescription for this?
You do need a prescription for this. You do need a prescription for this. There are not very many physicians around that know about this, unfortunately. There's about 100 physicians in the country that have studied peptides at this point.
Do you?
I do.
And you said
I
it's
do.
Serenity Health?
Yes. Mm-hmm.
Where?
This is in Waukesha.
Taking advantage
Yes.
of it.
We are in Waukesha. Our address, well, I can give you our phone number. That's easier. It's 262-522-8640. Any of our practitioners can help you with PT 141. It's not horribly expensive. It's about, I think it's about 120, is it 115? I think it's about 115. I might be wrong with that for a vial, but a vial will last you. I mean, if you use it once a week, that vial's gonna last you about 6 months, I bet, if not better.
Don't you have to go into your office to get it injected?
Yes. No. We can teach you how to inject at home.
Okay.
Yes, we teach you how to inject in home. It's just a little sub-Q needle. It's super simple. So we teach you how to do that.
Okay.
And then you can do that whenever it's convenient for you. It is, I have to say, it is amazing. It is absolutely amazing.
When it comes to the pill, I mean,
Yes.
so you think we're probably a year away from the
I think
pill,
we're probably a year away from the pill at this point.
and then you think that's going to work just as well? Maybe
That's
not.
their thought.
Okay.
You know, injection always works much better than anything you have to digest orally.
Okay.
But they're going to have some studies that are going to be pretty good. The question is going to be, will insurance cover it? Which my guess is going to be no. And it's probably going to be pretty expensive as a capsule.
Insurance doesn't cover Viagra, does it?
They do. Some do.
Okay.
But they limit you. You're only allowed usually 8 pills a month.
Okay.
They do. The insurance,
So is this
yes.
a forever thing then, as long as you want it? Or?
It's as long as you want it, you can use it. What I have found is once you start using it, there has to be some kind of lingering effect. Now they say no, that it lasts 72 hours, but I will tell you, I've only used this twice, but since I've used it, I think more about sex now than I did before. And I don't know if it's because we just used it and we had great sex and it was wonderful, and now I'm thinking about it more frequently, but I want to be sexy again. I want to dress sexy, I want to look sexy, I want to feel sexy. And before that, I could have cared less. Give me jeans and a sweatshirt and I was happy. Now, I don't feel that way since I've started using that. And I've only used it twice.
When? How long ago? I mean, how?
The last time I used it was 8 weeks ago.
Okay, so 8 weeks ago, and then what about the time before?
A week.
Okay, so
Yeah.
8, 9 weeks ago.
Yeah. And I still am interested and thinking about it, and it's very different than it was before I used it.
What are the possible problems?
Headache, nausea,
Okay, but
and
you know,
flushing. That's it.
Okay.
There's no permanent side effects that could be problematic because it's a peptide. It's an amino acid. It's an amino chain that your body should be producing from proteins anyway,
Okay,
but
so
it's
kind
not.
of like hormones. You're just putting
Correct.
back what was once there.
Correct.
Schedule conflict.
Yes. Schedule conflicts, that's about it, yes. Yeah. Be prepared when you take it to have the whole night because it's you're
Sure.
going to be busy the whole night.
What was that like?
Right?
I
Exactly. Exactly. Yeah. That is definitely it. Okay, so orgasmic dysfunctions. The other thing that we have besides Viagra for women and PT-141 is something called oxytocin. So oxytocin is our feel-good hormone. It's our love hormone. It's what we make a lot of when we're breastfeeding so that we want to pull that baby that's screaming all night close to us and love us, right? Well, it does the same thing to us when we take it on a regular basis. So we can give oxytocin for people to want to feel loving and reach orgasm easier. And for some women, it works very well. And for some women, they don't really see much of a difference at all. But sometimes we have to get to high enough dosages. We typically will dose 10 to 20 milligrams of oxytocin, but sometimes we need as much as 100 milligrams for some people. Now, oxytocin can be made in a rapid dissolve tablet that you dissolve underneath your tongue. And typically we have you take that about 30 minutes before intercourse. And it works similar to PT-141 in that it helps to increase blood flow to the vagina. It doesn't work on the nervous system. It actually helps increase blood flow and stimulation so that everything feels much more heightened. And it should help you reach orgasm faster. The only downside to oxytocin is if we give you too much, you become the green-eyed monster. You become very jealous very quickly and very easily. So if you take it on a regular basis and all of a sudden you start noticing you're jealous and you never used to be that way, it's oxytocin. But it's just a dosing issue. So we cut back the dosage, have you take a break for a little bit, and that goes away pretty quickly. But there are no other side effects to using oxytocin at all. Okay? All right. With studies of people using oxytocin, they actually found it to be 50% effective, which is pretty good. That's a pretty great number when it comes to sexual function. I already talked about intensity.
What about the others? So 50% for oxytocin. What about PT-141?
PT-141, 83% success rate in the studies from Palatine Company.
Okay. And what about
Just huge.
Viagra?
Viagra, they've never studied it in women, other than the study from Women's International that they studied 100 people.
What about in men, you think?
In men, it's pretty effective in men.
Probably.
I want to
83 or
say it's probably, yeah, I would say 60% or better
okay.
with
so
Viagra.
not as good as PT-141.
Not as good
either.
as PT-141 either. Yeah. So we have some good options. All right, pain during intercourse. Moisturizer, lubricants, estriol and testosterone, vaginal dilators, pelvic floor work, so pyo, yoga. Sometimes we'll have people, if there's been a lot of pelvic surgeries, they can get a lot of adhesions or scar tissue, and we'll actually have them go see somebody that's called a myofascial worker, and they can go in and gently break up the adhesions in the pelvis, and so that it's more comfortable for you to have intercourse. So sometimes we'll recommend that. Kegel exercises. If the pain with intercourse is really bad, we can actually add a steroid cream. So for some women, they get something called vaginismus. Literally, if you were to touch their vaginal area with a Q-tip, they would be flying off the table. They can't even usually wear pants. That rubbing bothers them so much. If that's the type of situation, then we would use an anti-inflammatory cream with a steroid cream. But for some women, as they age, it gets that uncomfortable, and we can use different medications in a vaginal cream with a numbing cream and a little nerve block and things like that to help make sex a little bit more comfortable as well. Okay, these are what vaginal dilators look like. So they look very much like a vibrator or a dildo. You typically would start with the smallest one and work up to the largest one if you can get up to the largest one. Some people would only get to here. But that helps just stretch the vaginal tissue out again so that it's not so small and tight and makes it much more comfortable for you. Pelvic floor work. So men that have erectile dysfunction can also have pelvic floor issues. So oftentimes they will have issues within the groin area. So we will send them to a physical therapist and have them work on their pelvic region to help release some of those muscles that are getting tense so that they can have better erections and it works a lot better. They can get blood flow constrictions and they can have spasms from all of the ligaments in the pelvis. And if that slows down the blood flow, then that's why they have the erectile issues occurring. You can also develop something called pelvic congestion. where the whole pelvis just gets congested with a lot of blood and blood flow isn't moving the way it's supposed to. So typically you will have a lot of pelvic pain. You'll have pain with intercourse. You usually have pain with bowel movements, sometimes pain with urination if there's a lot of congestion in there. Sometimes you'll have low back pain, and sometimes that'll radiate down into the butt and into the legs too if there's a lot of congestion in that pelvis area. So this can also be helped by pelvic floor work. And there's usually very specific physical therapists that are trained in this. Not everybody does this. You can also get muscle contractions in the pelvis area, which can cause problems with orgasm. And once we release that, orgasms are more intense and they happen more frequently and they feel much stronger. So it also releases the muscles so that penetration feels better. Because what happens if you have a pelvic floor issue, you tend to spasm or contract without thinking about it. So as the penis comes towards the vagina, it automatically contracts, and then all those muscles tighten up. And so if you can relax all those muscles and teach them to relax on their own, there's not so much pain, and then it's more comfortable for penetration. Okay. So if we have problems with pelvic tone, you're typically going to see weak or absent orgasms. We'll see stress incontinence. You cough or you sneeze and you leak urine. Some people will also leak stool if that happens, or if you lift something, you might have some leakage. That's a sign that there's a low tone in the pelvis. Okay. If it's severe enough, you'll actually get a prolapse of either the uterus or the bladder. You can also get a prolapse of the rectum. And so those things can be quite uncomfortable for people. And what you'll notice is a little bulge. Some people will feel a ball at the opening of the vagina. That's usually the cervix coming. Sometimes you'll feel a little pouch by the urethra. That's usually the bladder coming out. And if you have a lot of chronic constipation and the rectum's starting to fall, you'll actually feel a pouching in the rectum when you're having a bowel movement. And that's all due to low tone in the pelvis. Okay. Sometimes that's a congenital issue. There can be a collagen disorder that causes that. Sometimes it's a trauma. If people are lifting all the time, they have a heavy job, they're doing a lot of lifting, they could end up with some of this just simply from repetitive lifting and things. Okay, if we have a high tone in the pelvis, that's when the muscles are very tight and they don't move very freely, they don't stretch with activity. This is where yoga or pyo comes in very nicely, because you're stretching that pelvis, but you're also supporting it at the same time. Some people will feel uneven. This is a good time when people have their hips off. If you go to the chiropractor and one leg's longer than the other, that's usually a high tone issue. You've got muscles pulling something from one side or the other. Okay. High tone also can cause pain, both with penetration and orgasm. People with high tone issues will even have problems wearing tampons. Tampons will feel very uncomfortable for them as well. They typically will have constipation, painful frequent urination, and just this chronic constant ache in the pelvis can be there. You can also feel it in the tailbone. Sometimes you feel like something's being shoved up your butt. It just feels like something's poking you there, and it's just this constant feeling that something's there. That's usually a high tone issue as well. Okay. So some new advances that are coming out, and there's only a couple places around the city right now that are offering something called shockwave therapy. It's not that scary like Frankenstein shockwave thing. It is a pulsed wave, so it just feels like a little beat like this. They can actually use this. It creates a microtrauma in the tissue. Right now it's approved for men, but they're going to be approving it for women within the next year. So they can create this little microtrauma in the penile area that helps to increase blood flow, and that helps with erectile dysfunction as well. So by increasing that blood flow, you've got better circulation. It's not going to work in somebody with severe cardiac issues or an uncontrolled diabetic. It won't work for somebody like that because there's too much damage that's already been done. But for young, healthy people, or even older, healthy people that are just having a circulatory issue, it's shown to be very helpful for that. Like I said, they're studying it right now for women, so we're hoping that that'll be approved for use within the next year. But right now it's only used for men. It will be a non-covered service. It's not cheap. It's about $2,000 for a program. And I believe it's about 20 sessions that you can do for that. But it's showing to be very effective and very safe. So for people who can't use medication or don't want to be medicated, this is a nice option for them as well. And can be used in very young people. We can use this on 20-year-olds that are already having problems with that. Okay, questions. Kind of an odd